Hello and welcome to Health Live at Seniors Today. We are delighted to welcome here today Dr. Sandeep Patil, and he's going to be speaking about a subject that is very relevant and very important for everyone actually, but more so for senior citizens. That is the rational use of antibiotics. But before I welcome him, I'll introduce him. Dr. Sandeep Patil is Chief Intensivist at the Fortis Hospital in Kalyan. He has over nearly 2 decades of experience in critical care and internal medicine. He's done his MD in internal medicine, and early in his career, he received specialized training in intensive care, earning the IDCCM and the Indo-Australian Fellowship in critical care medicine. He's held significant roles in the field of critical care for the past 17 years. He's been associated with the Fortis Hospital as chief intensivist and consulting physician. He's highly experienced in managing critically ill patients across medical, surgical, cardiological, and neurological conditions. He's given the function that he has, he's proficient in advanced ICU procedures and point of care ultrasonography. We welcome Dr. Sandeep Patil today. Welcome, sir. How are you?
Thank you, sir, for nice introduction. So we start today, sir.
Yeah, we start today. We, as always, this is being recorded on October 4th, 2025. So those of you who are possibly watching it 2 years later, do remember that there are advancements in medical science. So you should update yourself whenever. But the request that we've made to Dr. Patil and his team at Fortis Hospital is to speak about rational use of antibiotics. Now, as part of the Seniors Today Health Life series, we've done sessions on polypharmacy in the past, but this one we are specifically requesting on antibiotics because all of us, before even speaking to a doctor, we tend to pop in an antibiotic because it has been advised to us in the past, and we thought it would be good to have a topic like this. Do remember that this is being recorded, and the recording will be up on the website early next week. And you can of course take notes if you would like to now, but it will be there on the website. Do also remember that the session is advisory in nature. So while you can seek advice, etc. here, and you can look at this session for all the advisories made, but do remember it's always better to meet a doctor personally for clinical examination and for treatment, whatever you may require. Over to you, Dr. Sandeep Patil. And we will, as soon as he finishes, we will take questions, and I will moderate the session as always. Over to you, Dr. Patil.
Yeah. Thank you, sir. Good evening, everyone. I am Dr. Sandeep Patil. I'll be talking on rational use of antibiotics. First, we'll start with basics. What are basically antimicrobials? Basically, antimicrobials includes antibiotics, antifungals, antivirals.
We can't see your presentation. We can't see your presentation.
Yeah. Basically, we'll be starting with basics. What are antimicrobials? Antimicrobials includes antibiotics, antivirals, antifungals, and antiparasite.
Sorry, doctor. Have you started your presentation?
Pardon?
Have you started your presentation?
Yeah, I started my.
No, we can't see it. We can't see it. No, we can't see it at all.
Oh, I'll just.
These things happen. We just saw it.
Is it visible?
No, it's not visible yet.
Okay. Just wait.
Just click on the share screen.
Now
share
it's
button.
visible?
No, it's not. Now it is getting visible. 1 minute. It is taking a minute. Yeah, we can see it now. You can just put on the full screen.
Yeah.
A few screens before this.
Yeah.
You're on the 4th screen right now. Can you go back?
Yeah. Now it's visible?
Yeah, but can you go back to the first screen?
Yeah, this is the first
No,
screen?
there are some two or three more screens before this.
This is the first slide.
I can see why resistance is a concern. That is the one which is coming just now.
Okay. Now it's visible.
It is visible, but I'm not getting the first screen.
Okay. Now?
No. I think you need to go click onto the first screen, number one.
Yeah,
Right
this
now.
is the number one only slide.
What is it? What is there on the screen of your screen?
Yeah, I'm able to see.
Okay, now try again. It has gone off. Try again now. Share again.
Again, okay. On screen two.
No, I'm not getting it yet. Yeah, now I'm getting it.
Yeah.
Opening. It's opening. One minute. It's opening. Yes, it started now. Yes, we are on the right screen.
Yeah. Now it's visible.
Yes, visible. Thank
Yeah.
you. Go ahead.
Okay. Yeah. Good evening, everyone. I'm Dr. Sandeep Patil. I'll be talking on rational use of antibiotics. So we'll start with first basic thing. What are antimicrobials? Basically, antimicrobials include antibiotics, antiviral, antifungals, and antiparasitic agents, which are used to prevent and treat infectious disease in humans and animals and plants. I'm saying why in humans, animals, and plants because antibiotics are now also used in uh, livestock and in agriculture also. So we'll be talking about the whole thing. So what is antimicrobial resistance? Basically, it occurs when bacteria, viruses, fungi, and parasites become no longer sensitive to antimicrobial medicine. Basically, they start developing resistance. As the longer they are exposed to that, they start developing mechanism to evade that. Okay, so this is called as antimicrobial resistance. Antimicrobial resistance is a natural process that happens over period of time through genetic changes in the pathogen. Its emergence and spread is accelerated by human activity, mainly by misuse and overuse of antibiotics. So, to prevent and treat control infections, basically in humans, animals, and plants. Okay. So this slide shows the burden of antimicrobial resistance in India. Basically, AMR represents a global challenge. Around 4.9 million people who have died in 2019 suffered from drug-resistant infections. AMR directly causes around 1.2 million of these deaths. 1 in 5 of these deaths occur among children. In this slide, you can see the deaths due to different disease, and the red one you can see it's because of antimicrobial resistance. Gradually, the deaths because of resistant infections are increasing as compared to other diseases. So why resistance is a concern? Basically, resistant organism leads to treatment failure and increased mortality. Then resistant bacteria can spread in community, added burden of healthcare cost, and threaten to return to pre-antibiotic area. Basically, if we have multi-drug resistant bacteria, most of the antibiotics would be resistant. So we are not left with any antibiotics. So it can be like a pre-antibiotic era. Okay. So what are superbugs? Basically, these are microbugs, which are microbes which are resistant to most of the class of antibiotics, and these have higher morbidity and mortality. As you can see, antibiotics introduced in 1950 then became resistant in 1962. Most of the antibiotic prescriptions, nearly 50%, are unnecessary. Okay. So 19 forms of new potentially deadly superbugs have been found in UK and around the world. Okay, and cost involved around 1 trillion, the cost of antibiotic in treating resistant infections, basically. And globally, over 7 lakh deaths each year can be attributed to antimicrobial resistance. Why India should be concerned about antimicrobial resistance? First of all, there is a high disease burden. India faces a significant burden of infectious disease due to heavy population and poor health care system. And antibiotics are crucial for treating these infections. And rising resistance make it difficult to combat common ailment. And challenges in healthcare setting, mostly overcrowded hospitals, limited access to healthcare facilities in rural areas, contribute to misuse and overuse of antibiotics. Then next thing is economic burden. Expensive and prolonged treatment of drug-resistant infection adds to cost of treatment. An impact on vulnerable populations such as children, elderly, immunocompromised patients who are at high risk of infection when antibiotics become ineffective. And agricultural use of antibiotic, widespread use in agriculture. Basically, in agriculture and in livestock farming, antibiotics are used basically to prevent infections and to increase the productivity. This also will lead to development of antimicrobial resistance and limited new antibiotics. Now, most newer antibiotics are very few in pipeline because companies are not interested. Basically, it takes longer research, lot of efforts, lot of financial things to develop a newer antibiotics. Okay. Basically, this is an article in TOI, Times of India. So you can see the antimicrobial resistance now at around 7 lakh estimate roughly deaths. And by 2050, it would be around 10 million. Okay. So the problem is going to increase as the day by day. So we need to use an antibiotic judiciously. And these are different basically articles published in newspapers. You can see basically WHO seeking uh, to curb menace of drug resistance and time to deal with antibiotics. And eating chicken could also make you antibiotic resistance because livestock are also being given antibiotics. So these livestock also have resistant bacteria in them. Okay. Then dairies lack means to test antibiotic usage on cattle. In surgery could soon become a deadly. Why? Basically, if patient is admitted in a hospital for his routine surgery, and if he acquires some resistant infection, his stay increases, his morbidity increases, cost of treatment also increases. Okay. And antibiotics effectiveness can affect cancer drugs, mostly in immunotherapies. Okay. So if we don't fight antibiotic resistance by 2050, up to 10 million people may die every year from untreatable infection. That's why we need to wisely use antibiotic. Who are at risk, basically older people and those with immune or impaired immune systems are likely to develop bacterial infections. Okay, so will lead to longer illness period, longer recovery period, frequent hospitalization, significant increase in healthcare costs for most expensive treatments. Use of these different antibiotics may cause different side effects and high risk of transmitting antibiotic resistant bacteria to other individuals. This is how superbugs rise. Basically, first thing is antibiotic use and misuse and incomplete treatment. Leave antibiotic course in between. Abuse or overuse of antibiotic in agriculture and spread of resistant strains. Lack of effective disposal mechanisms and having poor infection control hygiene in healthcare facility, okay, can lead to development of superbugs. This is basically a slide showing how antibiotic resistance spreads in community. If like an individual is given antibiotic, he develops resistant bacteria in his guts. He will transmit those bacteria uh, basically in community, or if he gets admitted in hospital, from hospital it can get transmitted to other individuals. And in because of lack of hygiene or no infection protocols, they can spread to other individuals in hospital. And antibiotics used in livestock or in this thing, agriculture or contaminated feces of these uh, livestock can also lead to transfer of these microorganisms into humans, or consumption of contaminated meat can lead to infections in humans. This is the chain transfer of antibiotic resistance. Basically, antimicrobial resistance will reduce the global GDP by around 3.8% by around 2050 as per WHO. Because failure to address the problem can lead to almost 10 million deaths, and it will increase the cost of healthcare. So, what is the rational use of antibiotic? WHO defines the rational use of antibiotic as prescribing the correct drug for patient's clinical need in right dose and for appropriate duration and at a lowest cost. The approach is critical for most effective treatment, preventing medication wastage, and combating the growing healthcare crisis of antimicrobial resistance. So this is how rational use of drugs to be implemented. First of all, right uh, dose of drug, right frequency of administration, and right route of administration, then right follow, and right indication, and right dosage form, and right duration of treatment. All these things will be prevent irrational use of drugs and prevent antimicrobial resistance. In this basically, how do we prevent antimicrobial resistance? Basically, following hand hygiene, then staying up to date on recommended vaccines so that you don't get infections, and prepare food safely. Properly cooked food will prevent transmission of infection, and avoid improper use of antibiotics. So only antibiotics which are prescribed by certified healthcare professionals to be used. Never demand antibiotics from your doctor. Always follow your doctor's advice while using antibiotics. Never share or use leftover antibiotics. Prevent infections by regulating washing hands, preparing food hygienically, and avoiding close contact with sick individuals, and keeping vaccination up to date. And choose food that has been produced within the use of without use of antibiotics for growth promotion or disease prevention in healthy animals. So Government of India and ICMR has taken initiative basically to prevent antimicrobial resistance. ICMR has issued guidelines for use of antibiotic in different infection and following infection control practices in hospitals. So One Health approach is the program. It basically covers all environment health, animal health, and as well as human health, so that transmission of antimicrobial resistance and judicious use of antibiotics can be done. Basically, what are the key principles of rational use of antibiotic? Know when antibiotics are needed. Antibiotics are for bacterial infection. Now, commonly it is seen that if we have viral infection, fever, cough, cold, many people take azithromycin, which is not recommended. And don't pressurize your doctor for any antibiotic. So common viral infection, common cold or flus can be treated symptomatically, or in those cases with immunocompromised or elderly, those with comorbidities, they can be treated with antiviral drugs. So no role of antibiotics in treating viral infection. Second most common thing is asymptomatic bacteria. Many patients were asymptomatic. During routine checkup, they find pus cells in urine, which is these patients don't have any symptoms of any fever or urinary frequency or pain. So this is called asymptomatic bacteria. This is commonly seen in pregnancy, then elderly individuals, diabetic individuals. So if patient doesn't have symptoms, no need of treating the infection. So there is no need of giving antibiotics. Only in those having symptoms, or in special cases, those with patient undergoing urological procedures or in pregnant patient, asymptomatic bacteria needs to be treated. And next thing is complete the full course of antibiotic. Usually most bacterial infection require 5 to 7 days of antibiotic course. In very few cases, in resistant cases or in certain infections, you require a prolonged course of antibiotic. So don't stop the antibiotic in between if you start feeling better. Even if you start feeling better, finish the complete course of antibiotic. And do not self-medicate. Never use leftover antibiotics or those prescribed for someone else. Many times patients say that last time I had fever, I had taken so and so antibiotic. Now I also started the same one. Now I got fever. So every time the same infection won't be there and the same antibiotic won't work. Okay. So you need to consult your doctor before starting antibiotic, and which one is appropriate. Let the doctor decide. So do not pressurize your doctor. Don't initiate any antibiotic for any viral illness. Your doctor will prescribe it. Follow instructions carefully. Take antibiotic as directed for your illness. Dispose of leftover antibiotics. When you're done, properly dispose of any unused medication according to your pharmacist or healthcare provider's instructions. So why it is important basically to prevent antimicrobial resistance. Why antibiotics are used unnecessary or incorrectly, patient bacteria can develop resistance to them. This is a major public health crisis because it makes common infection more difficult and impossible to treat, potentially leading to severe illness or death. And to avoid side effects, antibiotics can have side effects. Use them when not needed. Okay, when not needed exposes you to risk without any benefit, and most important, to save the cost. Using antibiotics only when necessary and reduces the healthcare cost. That's all. Thank you.
Thank you very much, doctor.
Yeah,
Um,
I tried to cover most of the things
yes.
basically.
And no, it was a very detailed presentation, doctor. We have a few questions which I'll now take. Uh, Doctor, why is it there's a question which has come in from Shobha Srivastav that
Yeah.
these days many doctors prescribe antibiotics for even small infections.
Yeah. Basically, small infection depends upon bacterial infections are there, then you can treat with antibiotics. But as I said, for simple cough cold, many patients have fever, viral illness, these flus subside in 2 to 3 days. In these cases, there's no need of antibiotic. But simple, if you are symptomatic urinary tract infection or lower respiratory tract infections, pneumonia, then you need to treat with antibiotics. Okay.
Right. We have a question from Sharda Parvare, who asks, is taking antibiotics for a long time harmful? Because I've taken it for a long time unknowingly and suffered very badly.
Yeah, basically, long-term antibiotics are recommended only in few cases. As I told, most of the bacterial infection require 5 to 7 days of antibiotic. Only longer duration is required in resistant infection. As we were talking of antimicrobial resistance, if we get infection with resistant bacteria, in that cases, 2 to 3 weeks of antibiotics, or in case of meningitis or in this thing, pyelonephritis, kidney infection, urinary tract infection, which has gone till the kidneys. In that cases, we require, or if there is any infected device in the body or anything, in that cases, you require a prolonged duration of antibiotics. So in that case, basically, prolonged duration of antibiotics will definitely cause side effects. It cause GI side effects, diarrheas. Yeah.
Right.
Yeah.
We have a question from Sunita Verma who asks, do vegetarians have less chance of antibiotic resistance than non-vegetarians?
Pardon?
Do vegetarians have less chance of resistance to antibiotics than non-vegetarians?
No, no, not necessarily that. But and basically now, as I showed in the slide, if we cook food properly, transmission of infection is less. And even in food, this thing in agriculture also, antibiotics are used basically to prevent infections. and increase productivity. So it doesn't affect vegetarian or non-vegetarian as such. Okay.
Right. Thank you. We have a question, very basic question from Anupam Patak. He asks, Doctor, how can you identify that a prescribed medicine is an antibiotic or not?
How do you?
How do you identify whether a medicine that has been prescribed is an antibiotic or not one?
How do you identify?
Yeah.
Okay. Now, basically, most of the common antibiotics are cephalosporins, or penicillin, or fluoroquinol. Means usually it is written on the strip what it is. Okay. There's no separate as such thing, and you can consult your doctor basically. And most of the antibiotics are available with only doctor's prescription only. Now, here in India, sometimes over the counter also pharmacists give it, like azithromycin, which is commonly used by many people just for common cold. Okay.
Right. We have a question from Shamla Ravi who asks, what is better, IV or oral antibiotics?
Pardon? IV?
What is better? What is better for treatment, IV or oral antibiotic?
No, if you have a severe infection like uh, hemodynamic, sepsis or septic shock, in that case, is you require IV antibiotics. Okay, but if the patient is stable hemodynamically, patient is taking orally, hemodynamically, say pulse, BP, everything is stable. In that cases, you can start on oral antibiotics in simple cases. But when patient is critical, BP, means hemodynamically unstable, plus BP is not stable, or having a urine output is reduced or respiratory difficulty, these are critical patients. So in that cases, IV antibiotics are preferred.
Right. This is a question which has come from Praveen Kumari, who asks, what quantity of water should be taken with antibiotics?
There's no recommendation as such. You can take as much as quantity, as much as water. There's no recommendation as such. You have to stay hydrated basically. Okay, quantity of water you can take with simple one or two sips. Also, you can take a 1 glass of water. Okay? But basically, since you are suffering from infection, you have to stay hydrated.
Right.
There's no quantity recommended as such.
Doctor, we have a question from Katie Dadanchi who asks, Doctor, should we take a Bicosule vitamin tablet with antibiotics as some suggest?
Bicosuls are basically multivitamins. So you can take along with basically now what happens is if we are taking antibiotic, they kill the pathogenic bacteria also, and they will also kill the good bacteria in your gut also. So so to replace that, you can take this Bicosul. Basically, Bicosul is a multivitamin. They are the supplements along with that. Okay.
Right. Um, and what about medicines like Pan-D, etc., which are there for ensuring the tummy is in order, the gut is in order?
Yeah, PANDI are basically proton pump inhibitors. Basically, they are used to reduce gastritis, acidity. So if patients are having GI disturbances, acidity or gastric disturbances with antibiotics, so you can take these proton pump inhibitor, PANDI.
Doctor, we have a question from Anupama Singh, and there's another question that has come in from another reader. They're saying that, uh, Doctor, there are times when two different doctors advise antibiotics which may perhaps clash. How do we prevent that?
See, basically, if you are treating some infection, there are recommendation for antibiotics. Basically, now guidelines have been given by government to which antibiotics, which class of. So you can use either of that. There's not specifically that only particular antibiotic should be used for that infection. Now, suppose if you are treating urinary tract infection, it's a community acquired infection. So most common organisms are E. coli. So you can use those antibiotics which work on that.
Right.
Yeah.
One last question, Doctor. this is some Dr. Mr. Lakshminarayan has said. In my view, this has to be the last resort. As I understand, there are going to be side effects of having antibiotics.
Yeah.
Um, a question. Okay, another question that has come in is, Doctor, do antibiotics kill good bacteria gut?
Yeah, basically antibacterias, basically they will reduce your gut bacteria also, good bacteria in the gut. Okay, the prolonged antibiotic intake should be avoided. So that's why I recommended 5 to 7 days of antibiotic is enough. Okay.
Great, doctor. I think we've answered most of the questions today, that have come in. Thank you very much, doctor, for this session.
Yeah.
And to all of you here, we'll be back again next Saturday at 5 p.m. at our regular time. And do remember that this session that we've done is actually on September 28th, which is when the penicillin was discovered, right? Was it because of it is his birthday? The rational, it is actually, it is Alexander Fleming's discovery of penicillin was on September 28th, and that is observed as a rational use of antibiotics day, and which is why we've had this session. Thank you very much, Dr. Sandeep Patil, for this session today. We will be back again next Saturday at 5 p.m. Thank you, Dr.
Thank you, sir.
Thank you to
nice interaction.
thank you to the team at Fortis Hospital for facilitating this. Do remember that we have, apart from the Health Live at Seniors Today, we also have Seniors Have Talent, which happens every Wednesday, and a host of other events that happen daily as part of Evergreen Club. Thank you very much.
Yeah.
Bye-bye.
Thank you.